Okay, thank you everyone so much for joining us today for Congresswoman Schreier's telephone town hall to update supporters on the latest on the coronavirus outbreak and congressional response. We're so glad that you were all able to join us today. And with that, I will introduce Congresswoman Schreier, and she can take it away with some brief remarks for us before we get started with some questions. Congresswoman?
Thank you, Devin, and thank you, everybody, for joining. This is Kim Schreier, Congresswoman and doctor in Washington's 8th District, and thank you for helping to get me into Congress, because I think it turned out to be a really important time to have a woman doctor in Congress. We could start with the measles outbreak from a year ago, and concerns about women's reproductive decisions. But, this is a really big one. And taking on a pandemic and understanding what it means and understanding the directions that we are getting and how to interpret them, what I have found is that my voice has been a really important one in Congress and for my constituents who just want straight answers. And sometimes signals coming out of Washington, D.C., are quite disparate, and mixed messages are incredibly harmful at a time when we are taking on a pandemic as serious as this one. And so I wanted to be able to reach out to all of you to give you a bit of an overview and then to answer questions about some of what I've been working on, or even questions that you have about your own particular circumstance and what recommendations might be there or what I know. So I first just want to say that, speaking today, it is really nice to see all of the messengers essentially delivering the same message, that there is no more downplaying as far as I can tell. People are understanding the need to stay at home. They're understanding that our one weapon against coronavirus is keeping our distance from one another and not allowing this virus to spread. And it is really nice to not have to push back against conflicting sources of information. That said, we are still in a really tough situation. We don't have enough tests. We don't have enough equipment. We are putting ourselves in economic distress in order to get control of this public health crisis. And it is important that everybody just sort of continue to do whatever we can to protect the community at large. I wanted you to know that from Congress, I've taken on a couple different roles. One is simply being a medical voice out there, somebody to deliver straight information. But the other is as a member of Congress in crafting legislation and thinking about what's coming down the line and what we need to be thinking about. Here in Washington State, our entire delegation has joined together. Democrats, Republicans were on the phone multiple times a day, working often from our homes because we are socially distancing, but on the phone with FEMA and HHS and CMS and the governor's office, trying to go to bat for our state to make sure that when the governor requests supplies from the national stockpile, that we can echo that and put our weight behind it and get that equipment to our state. That when our hospitals are running into trouble and they're saying, my gosh, we have these ridiculous rules that are keeping people in the hospital who don't need to be there. Can we relax these rules in order to have some nimbleness and flexibility? We go to bat and we write those letters and we get in touch with CMS and we get those regulations, if needed, temporarily relaxed. And that is how we have managed to really support our state and our state's Department of Health in doing what I think is probably the best job in the nation in terms of taking this on. Washington was hit first. We were hit hard with a nursing home, which is the most tragic place you could have this land. And our Department of Health stepped in right away and started talking immediately about social distancing, started talking immediately with hospitals about stopping or slowing elective procedures so that we could free up room in our hospitals for the surge that would come. We saw what had happened in China, and we wanted to prevent the same thing from happening here. And so I am thrilled to be living and working in and for the state of Washington and lobbying on behalf of, or working on behalf of my constituents, there is still work to be done. We still need more protective equipment, and we still need more tests. And what we hear on a national level often does not translate to what we see on the ground. We will hear that millions of tests are available, but that's only in theory if you don't have swabs available or pipettes available or the little tubes that carry those tests or the reagent that helps run the tests. And so we are still stumbling over ourselves to get adequate tests. With personal protective equipment, we continue to stumble there as well because of delays in domestic manufacturing, because equipment has been needed across the world all at the same time, and our traditional sources for masks and gowns and face shields is China. We are scrambling there as well. And enacting the Defense Production Act would go a long way towards really harnessing the manufacturing power in this country. And most of us are like-minded in wanting to see that happen 2 weeks ago. And we have been asking for a stronger hand from the federal government in terms of being ideally the sole procurer of supplies and the distributor of supplies. And as long as there is trust that those will be distributed according to need, that would go a long way to making currently hard-hit states confident that they will have the resources they need, but also states that will get hit later be confident that the resources will be there for them as well. Right now, with this degree of uncertainty, with other states watching, New York, California, and Washington not having enough equipment, I could not blame Nebraska, for example, for wanting to do the same and hold on to their masks and their ventilators just in case the same thing happens to them. And that is really why we need a federally coordinated response to assure us that the supplies will be there when we need the supplies to be there. I wanted to touch on some of the things that we've done legislatively in order to help our country through this crisis, and then I will take some questions. We've passed 3 bills already, and this is 3 of, I would imagine, at least 5, and they continue to get larger and larger as we understand the scope of this crisis and how important it is to really shut down our communities and shut down our economy in order to combat this public health crisis. So the first was simply immediate aid to reimburse public health departments across the country for the work that they were doing with identifying cases, tracing contacts, things that had been going on the ground that really had taken over public health departments. It also had small business relief and put billions into looking for a vaccine and treatments. The second bill, which came just probably a week later, really focused on making sure that we were providing the financial ability to do the right thing. In other words, if we are going to ask people to stay home when they have any sign of illness, we need to make sure everybody has 14 days of paid sick leave. If we are going to ask students to stay home from school, we need to be able to provide paid family leave so that a parent can stay home with those children. If we are going to ask people to get tested, we need to make sure that they are not having to pay huge sums of money out of pocket to do the right thing to stop the spread of this disease. And granted, this was before we had limitations on the number of tests out there. So what we did was we made testing free. That was my part of the bill, that free testing. If you have insurance, there's no copay, no deductible. If you don't have insurance, it's free through public health to make sure that we could get the tests to the people who needed them, insured or not insured. Anybody was covered. And it also boosted nutrition programs so that kids who are out of school can still get their school breakfast and lunch, to make sure that we gave more money to SNAP, to food stamps, and to WIC, to have that paid sick leave and to have the paid family leave. And then the third bill was this really big one, $2 trillion. This is the biggest package that Congress has ever passed, ever. And this one really was unprecedented in its scale, but also people refer to it as a stimulus package. And it's really not a stimulus. It's a rescue package. It is a way to say, if we're going to shut down our economy, we need to make sure people aren't kicked out of their homes or out of their apartments. We need to make sure people can still put food on the table. We need to make sure that people can come out of this whole, whether that is in a month, 3 months, 6 months, or a year, whatever this takes, that we can cushion the blow. And ultimately, how we come out of this depends on how we handle the public health crisis. But we have been very fortunate to have the Fed dropping interest rates to the point that banks can take the step of allowing people to not pay their mortgage for several months, and to allow small businesses to have loans that have loan forgiveness if they keep their employees on payroll. And so this is a huge and generous package that does everything from taking the individual and making sure they can get unemployment benefits that are more generous than usual for more time than usual, and to get them without a 1-week waiting period, to putting actual dollars in every person's hand who earns less than $75,000 a year for an individual, $150,000 a year for a couple, so that a family of 4 who falls in that income, under that income threshold, will get $3,400 cash payment as soon as possible. This can be done by direct deposit. That means people can pay their bills next month. It has rental and mortgage assistance for people in low-income housing. It has abundant small business assistance. It helps large industries, for example, the airline industry, the hotel industry, where across the board they are economically devastated. And it's not just for the corporation, it is for all of the people that that corporation employs. And so by helping them, we are helping the community. It has $150 billion for the healthcare system and hospitals, because right now they are stopping elective procedures to take care of thousands of patients with this particular illness, and they are underwater financially. And of course, it needs to help state and local governments, because when businesses close and there is no tax base in cities and states, then they run out of funding and can't perform their duties. And so we have tried to take so much into consideration for this bill, but still know that there are gaps that we will have to fill with future interventions. So with that, I just want to thank you all for helping to get this doctor to Congress, and I am so happy to take your questions.
Thank you, Congresswoman. I want to remind everyone that you can ask a question at any time by pressing the 0 key on your phone keypad. If you press the 0 key on your phone keypad, then we will be able to field your questions. So first, we'll start off by a question that was sent to us via email. And this question is about the packages that have passed through Congress, and if you can speak to your specific provisions that were introduced, including the testing bill or other bills that you introduced in these packages.
Yep, thank you for asking that question. I know I touched on it in my initial remarks, so I won't repeat too much, but one was my bill to make sure testing was free, again, to make sure that there was not an economic barrier to doing the right thing to combat this disease. And so the more testing we do, the more information we have, the more we can have ill people stay at home and healthy people out. And of course, this hasn't played out simply because not enough tests have been available. But the fundamental idea was, if we want people tested, we can't make them choose between getting tested and putting groceries on the table. The other part that was really important to me, and I'm on the Education Committee and also on the Agriculture Committee, and both of those touch on childhood hunger and family hunger. And so SNAP programs, school meal programs, those are under my committee's jurisdiction. And so what I looked at is, hey, if we close schools, we have to worry about the education And we have to worry about parents who have to miss work to stay home, but we also have to worry about those kids whose only nutritious meals may come from school. And so this meant really mobilizing a school nutrition program to get 2 meals a day to all children on free and reduced lunch programs all across the country, how to deliver it, and how to relax some of the rules and regulations there so that we can do the best possible job getting food to people. And I should just mention, in the state of Washington, our governor went further. He said, you know what, even if you didn't qualify before, but now your family has a financial hardship, you can have access to that as well. And so we just have a really wonderful partnership between the federal benefits and what our governor here in Washington has added on. The larger bill was really put together very much electronically, by phone, by email, by conference call, where we all put in what things we wanted in there, and it had things like not just free testing but free treatment, and it had things like more robust unemployment insurance, and even how to get small businesses loans so that they could get loans and loan forgiveness if they kept their employees on payroll, because it is so much better for the economy to bounce back if workers can still be on payroll from small businesses. Even if they shut down temporarily, they can then bounce back when the economy comes back. And so those are the kinds of things that we all played a role in making sure got into that second package. Do we have another question?
Great, yes. We have a question from Tom Odell in Sammamish, and he has a question about the group in the administration, and I believe his question has to do with the group that was originally put in place to deal with pandemics like this, that the Trump administration removed. But I will go ahead and let him ask his question.
Okay.
And
hi,
go
Mayor.
ahead. Thank you.
Hello, Mayor. How are you? I don't hear Tom Odell on the phone.
And are you still there, Tom? Okay, got it. We might have lost him. If we join him again, then I will try to bring his question back on there. Okay, next we have a question from Steve, and he is calling from Redmond, and his question has to do with how we protect ourselves, I think, from Donald Trump and from the administration. It sounds like the question is angled around, of course, this disease is dangerous, but there's been some dangerous rhetoric used around it as well. So go ahead, Steve, and ask your question.
Hi, Steve.
Hi. My question was very simply, this guy is basically holding press conferences to benefit himself in his reelection campaign, and he's so addled about what to do, and it's so disconnected. It's really, really scary when the nation really needs a strong leadership. And what can we do? Anything can be done about that?
Steve, thank you for your question. I have tried to not get too deeply political when taking this on. I've really tried to focus on, hey, here's where we are now and here's where we move forward. But I mean, it has become so obvious that there were not just missteps and errors, like unfortunate circumstances of the CDC original test that, really hamstrung us for quite a while and still does. But the devastating downplaying of this pandemic that was going on for weeks, months even, and blaming rather than taking this on with the full force of the federal government. And that downplaying ultimately jeopardized the health and the safety everywhere in this country. There are still lots of people out there, perhaps half of the population in this country, that believes that this is no more than a flu. And that is dangerous, because when we then ask people to stay at home, to shutter their businesses, to keep their kids home from school, they don't believe that it's necessary. And what you end up with then is devastating public health outcomes and people dying. I believe that we would all be best served if we did not have anybody in any political position delivering those daily press conferences. If this were wartime, I would expect those briefings to come from a general. And in this current, essentially wartime in a public health war, I believe that those briefings should come from Anthony Fauci or from Deborah Birx. I think that we need a trusted voice with a steady and consistent message from somebody who has authority in this area to be guiding the ship here. And to have mixed messages coming out is incredibly destructive. Not just that, a failure to take bold action because of a general philosophy that government should not be big. This is a time when we absolutely need government to be big and to lead and to say we need swabs and reagents and masks and gowns and more oxygen tanks and more intubation sets and more ventilators, and get manufacturing. We saw that they did it and needed it in China, and there was no reason for delay in this country. And so I hear you, and I am still focused on moving forward from here. And in fact, have joined a small group, including Democrats, Republicans, Senate and House, a few of us doctors who are really looking for a way to have a solemn and helpful message going forward, to have a voice of we stand ready to help, as opposed to a hypercritical voice, because I think that the administration is much more likely to listen if we approach from the stance of we are here to help and guide and help you think of things you might not be thinking of. We don't want too many cooks in the kitchen, but we would like the main cook to do the right thing. All right. Who is next?
Thank you. Thank you. I want to take this moment to remind everyone that if you have a question for the Congresswoman, you can ask that question by pressing 0 on your keypad at any time. The next question we have is from Jim and Bob in Sammamish, and their question has to do with studies and data around COVID-19. Jim and Bob, go ahead and ask your question.
Yes, thanks.
Hi, Jim and Bob.
Hi, Kim. And thank you very much for the very calm and straightforward approach you're taking to this. There's a really interesting piece on the University of Washington's Health and Metrics group that showed they're anticipating a peaking of COVID-19 cases in, I think, 20th of April or maybe 21st of April. I'm less interested in your opining on that than I am in understanding or learning if there are things you're looking at as a doctor and as a legislator that as far as trends, et cetera, is there a source that is just interesting that we all should be looking at that you think might be particularly reliable, et cetera, and whether you've looked at the University of Washington data as well? That's all. Thanks.
Yeah, thank you. Thank you, Jim and Bob, and thank you for helping to get me here. Yes, I have seen the University of Washington study. I saw another one last night, and I am struggling to remember the source. But, all of these models really depend on a whole bunch of variables. The one I looked at last night really assumed that whatever current measures are in place, in other words, for Washington, it would be all essential businesses closed, social distancing, schools closed, everybody's home. If we continue on that path, what will things look like? And it was very interesting to see things like what you just alluded to, that our peak would be expected to be on April 21st. I'm going to use your data because I can't remember, whereas the peak in New York City, for example, or in the state of New York, was going to be on April 7th or 9th. It was much sooner, and that it was demonstrating how the earlier you can enact these policies, especially in a place that has a less dense population base, that you really can help to flatten that curve, and that translates to a very different mortality rate. In fact, I'm going to go a little bit on a tangent here. A lot has been said about the mortality rate in different countries. First, people were talking about 3.4%, and then people said, well, why is it so much higher in Italy? Why is it so much lower in Germany? And there are a lot of reasons, but I think that part of the calculation is inherently how deadly is the virus if you have a perfect health system in place that can accommodate every patient. And then there's the other part of this, which is if you don't have a perfect healthcare system and you don't have enough ventilators and you don't have enough ICU beds or hospital beds or doctors or masks, then what happens? And it's those situations that actually can make a death rate spike from what could be 0.5% up to 5 or even higher percent. And that's what we're seeing in Spain and in Italy right now, what we're trying to prevent here in our country. So I have looked at many of the models, probably the same ones that you have looked at, and I take them all in aggregate because they all make slightly different presumptions. And frankly, we don't have the testing, like the population-wide testing to really know how much is out there, who has it, who's already recovered, how far through this are we? And we're flying blind in a lot of ways. So thank you for the question, both of you. Who's next?
Yes, thank you. And just as a reminder to everyone, if you press 0 at any time, you can ask a question of the Congresswoman. We have a number of questions coming in, so thank you for your patience. A nice question to segue into is Catherine's question. Catherine is calling from Wenatchee, and her question has to do about testing kits. So go ahead, Catherine, and you can ask your question.
Hi, Kim.
Hi, Catherine.
I think you're wonderful. Hi.
Oh, thank you. Hi.
So many wonderful things. So anyway, I've seen you here in Wenatchee lots, and we're 80 years old and sheltering in place. But the last time I heard about Wenatchee's testing kit situation, we had like 500 of the kits. I don't know if we've had more by now, but I was just wondering how things are going in stocking Washington State now with testing kits and PPEs, masks. My son is a physician, and I'm worried about him, amongst other people. It's a terrible crisis. Yeah. So do you have any more information on the supplies that are coming into Washington State?
I do. And Catherine, thank you for your comments, and thank you for asking. Right now, so much of the focus has been on King County that I know Jamie Herrera Butler, for example, has been calling attention to the fact that Vancouver doesn't have enough. And then, Wenatchee is not getting enough, nor is Spokane. And we really do need to think more globally about the state. Testing, tests are at this point sort of theoretically available. I know that Confluence Health in Wenatchee had drive-through testing really early. This was a couple weeks ago and had to shut down because of a lack of availability of tests. And just to be clear about what a test kit is, because I know some of this is really vague. A test kit is a swab, a test tube that you put that in with a medium, could be saline or something else for it to travel in, put into a Ziploc bag and then sent to a lab. And the Wenatchee right now is sending to private labs, and that has made things a bit more difficult. And also, our state does not yet have swabs where people can just do their own. So in order to have a test done, somebody, like a doctor or a nurse, needs to put on full protective gear just to do a test. And that is why all over the state, these tests are really being reserved for emergency responders, medical personnel, and people who are already in the hospital. And we are going to be limping along like that as long as we continue to have these supply chain interruptions. And that is where the Defense Production Act could really help, or at least having the federal government take a very strong hand in saying we are going to buy up all swabs and all reagents and we will distribute them so that states aren't competing with other states, that cities aren't competing with other cities to get the same equipment. It is leading to hoarding behavior the same way people are hoarding toilet paper, and it is not in anybody's best interest. You had another part of that question. It was about equipment, personal protective equipment for healthcare workers. So we have been supporting our governor's requests every time he makes a request from the Strategic National Stockpile. And we do continue to get shipments from the Strategic National Stockpile. They go to the state, and the state distributes that to where there is the greatest need. We typically don't get everything we ask for, but we are getting supplies from there. And I think sometimes we think of the national stockpile as something that will run out. At the same time, we are getting distributions from the national stockpile. They are replenishing the national stockpile. So it's not going to run out. It is just a way that the government currently has to help states who aren't getting everything they need off the private market get it from the federal government. It's kind of an in-between of where I would like to see us and where we have traditionally been. I just heard last night that HHS is sending 100,000 Tyvek suits to the state of Washington for our healthcare workers. These have not arrived yet, and so we know that we can't totally count on it until it is in hand. But to have those full zip-up, fully protective bunny suits for our healthcare workers is a tremendous win. And so just please know that our state has been working very closely with the Vice President, with FEMA, HHS, CDC, to make sure that we get the equipment that we need and that we can protect our first responders and healthcare workers. Do we have another question?
Thank you. Yes, absolutely. I want to take this moment to remind everyone that if you have a question for the Congresswoman, you can ask that question by pressing 0 on your keypad, and we will get to as many questions as we can. The next question is about the ventilator supply, and this question is from Bruce Williams. Bruce, you can go ahead and ask your question.
Thank you, Congresswoman Schreier. This is Bruce Williams in Leavenworth. Thanks for all you do.
Hi,
Thanks
Bruce.
for being there. Great to hear your voice. Where are you anyway?
Oh, so Bruce, first of all, hello, and please say hello to Drew for me as well, and thank you for taking me through the medical center in Leavenworth. I am speaking with you from my house in Sammamish.
Well,
I am doing my stay-at-home order just like everybody else.
Well, thanks. My question, which is hard, I know you can't answer precisely, but maybe you can give us some thoughts, is, just here in Washington State, if we get this surge in patients, one of the questions is, are we going to have enough ventilators to take care of everybody? And do you have any perspective on whether we're likely to, and whether the federal government, it's like the test question and the PPE question, is the federal government doing what it should be doing to help us have enough ventilators? Any thoughts you have about how this might play out? Thank you.
Thank you. So the study or the model that Jim and Bob brought up just before suggested that we would have enough hospital beds, we would not have quite enough ICU beds, and we will not have quite enough ventilators. We would be short several hundred on the peak day, which was, I believe, April 21st. And that is one model. So the bottom line is that we don't have an accurate count of how many ventilators are in this country. And the number of ventilators that are in the strategic stockpile is a confidential number, but has been rumored to be about 10,000. There are not enough ventilators, which is why it is so important to flatten the curve. Now, the other thing is that this whole psyche of people hoarding toilet paper, states looking at what's happening in New York and Washington and California and holding onto their masks and holding onto their ventilators means that nobody's going to have enough when the time comes for their locality. And what I would love to see is at the same time that the federal government purchases, prepays for Ventec and GM to make ventilators, that at the same time they go out to each state and they say, where are all of your ventilators? Let's get the ventilators that are in North Dakota in an outpatient surgical center that are not being used right now, or that are in a plastic surgery center. Get those and move them to the parts of the country where they are needed, with a promise that they will be moved back to North Dakota at their time of need. And that is where I think the federal government could do this, and then could show that because we are involved in this manufacturing agreement between Ventec and General Motors, and we can give a promise to be done by date, that they can then have the confidence of knowing that they won't be left behind and stranded. And that's why we need that kind of leadership and control on a federal level. Thank you for asking the question. In the meantime, by the way, ventilators have been just such an interesting topic to see how they are using ingenuity, which is not, this is not ideal, but to be able to use one ventilator for 2 to 4 people, because people who get this particular disease and need to be on a vent, they're not just on it for a couple of days. This can be for weeks. And so I am glad to see that finally a deal that GM and Ventec had been working on putting together and sourcing supplies for, finally got approval from the president and got prepayment. And I just want to clarify, since I'm on the political side call here, that was not a use of the Defense Production Act. He claims that for the media. That was a deal that was waiting for his approval and that he was standing in the way of, and in fact almost pulled out of, because he saw the price tag. This is not a time to hit the pause button. We just passed a $2 trillion bill so that we would have the funding to put $1 billion into buying ventilators. That is what is needed in this kind of response. So thank you, Bruce. And who else do we have on the line?
Hi, I will take this moment to remind everyone that you can ask a question of the Congresswoman by pressing the 0 key on your phone pad. We are getting a number of questions and we'll get through as many as we can. The next question comes from Jennifer in Seattle, and she has a question that many folks have about our schools and the services, not just learning, that students rely on in these schools, and how we can continue to take care of our kids. Jennifer, you can go ahead and ask your question.
Hi, Jennifer. I have a very naive question. So schools have essentially been on hold partially because the schools have been providing needed food to children who otherwise were receiving it through school, which is really important. But the fact that they have to do it that way and that school then has stopped because of it underscores how desperately underfunded the schools are. And here's the naive part. Every day of my life, I wonder, why can't we just make the most wealthy people in the state adequately fund our schools?
So, Jennifer, thank you for the question. I want to make sure I fully understood. There are many ways that we could restructure how we pay for things in our state. We do not have an adequate revenue base in this state, especially compared with states that are far smaller and have smaller scale economies. Our revenue pales in comparison, and how you do that, I think, is just a matter for discussion by our legislature. But in terms of the schools, you are right that education is part of the equation, but the other part is really making sure that they have a safe place to be and making sure that there is nutrition for them. And our schools are stepping up in unbelievable ways right now. I have an 11-year-old in 5th grade at a local elementary school, and we get information about where the 2-meal-a-day per child pickup sites are. In some areas that are more rural, they are actually putting the food, the meals, on a bus and sending the bus routes around. And at the bus stop where kids would normally get on the bus to go to school, they are then offloading food for families because not every family has transportation. And so the way that they're imagining this in different parts of the state just shows the nimbleness and creativity and devotion of our schools. Teachers are doing the same thing, figuring out how to get hotspots into homes so that kids can learn remotely by Wi-Fi, where others are delivering packets or having packets at a school for parents to come by and pick up so kids can work on them at home. And I think we are seeing ingenuity and resourcefulness right now, and we're all going to just have to make our way. My concern really is not for the kids who are doing fine in school anyway. I mean, for those kids, you can probably just stick a couple books in front of them and they'll be fine, and they're not going to have kind of that summer slide. But there are a lot of students who don't have books at home right now, who don't have Wi-Fi, who don't have parents who are equipped to teach them. And for them, the superintendents are really looking at how we can recover those skills later. So I would expect expanded summer school, for example, to help kids catch up on this lost time if needed. Do we have another question?
Yes, and as a reminder, you can press 0 at any time if you have a question. This next question comes to us from Deanna in Auburn, and her question is about centralized management for this kind of crisis and plans for the future. Deanna, you can go ahead and ask your question.
Kim, my background is in management, organization, problem solving, planning. And when I look at what's going on right now, I cannot help but wonder if there is not a mechanism or a possibility for bringing together some resources so that we can actually set up a nationwide database, so that we can actually structure some kind of an oversight. One of the organizations that I think about is the Gates Foundation. They certainly have a history in overseeing healthcare problems worldwide. If nothing else, from a problematic problem-solving perspective. The other thing I see is that there's the military, who are boots on the ground, who are people all over the place, expertise all over the place. I've got a husband who is a 30-year veteran, and the expertise within the military is phenomenal, even within those that are retired. I do not understand why we cannot in some way bring in those generals and sit them down and say, this is our problem. How can we do this? How can we get a single database so that we know where all the respirators are, so that we know how many of them there are, how many masks, how many, et cetera, and be able to manage that along with the perspective of what is possibly going to happen. There are universities all over this country that, again, have done research, have background information, have staff that are incredibly skillful. I wonder how we can bring those people in some way, whether it's online, whether it's by telephone, whatever, but find the people with the expertise and set them to problem solving, creating some action plans, establishing some directions, and then implementing them. Does any of that make
Yep, that makes perfectly good sense, Deanna. First of all, thank you for bringing up all of those topics, because you're right. This is what federal leadership looks like. It is taking command of a situation. You are right that it requires, I believe, that kind of military efficiency and kind of being methodical about the process. I on a phone call with FEMA the other day, they referred to tracking stockpiles of masks and other equipment throughout the world, figuring out where they are, figuring out where to get them to. So I believe that this database is underway, especially now that FEMA is in control. Hopefully, things like the database will be well managed. FEMA is not expert in matters healthcare, and so it is good that they are working hand in hand with the HHS, and we are making sure that the right people are thinking about exactly which items need to be tracked and thought about in advance. In terms of the military, we have at CenturyLink Field, our Seahawks Field, our first field hospital. The Army Corps of Engineers showed up yesterday. I got to be there and meet General Cherry and all of the soldiers working with him who were in there busy making plans to open this somewhere between 148 and 178 bed fully functional hospital in that room. It is going to have operating rooms, hospital beds, and it will be devoted to patients who do not have COVID-19. It is phenomenal. And their time frame for turning this big empty room into a fully functional hospital is about 72 hours. And that is stunning. And that is what our country can do when we put our mind to it. And I am incredibly grateful to our military for doing that. This is what's happening in New York as we speak. And it gives me a high degree of hope that we are going to be able to not just have these field hospitals, but one of the next things we're going to need are sort of tents, hospitals, temporary facilities where people who get coronavirus can go during their recovery period so that they don't infect members of their family, so that they can be there if they take a turn for the worse, and there's oxygen already there and available when they need an escalation of care, or they just get better and then they go home. But it is one of the things that they did in China with taking people who were sick and having them in a place where they could be safe and not infect others. And I know that there's questions about how that could work, but I do believe that is one of the keys to getting through this and having as few people affected as possible. And last, you talked about the Gates Foundation. Just this week, they started sending out kits to people's homes so they can swab their own noses and send it back in. And this is how we're going to get our first baseline, broad-based epidemiological study of what is going on. They're going to send out kits every day, and they will be able to watch in kind of a randomized sample of the population in Washington State where this disease is, who has it, whether they have symptoms, and how this changes over time. So yes, they are an incredible resource. They also just put in, I believe, $10 million to the University of Washington to increase their testing capacity. So a huge thank you to the Gates Foundation, to our military, to University of Washington, and to all of our leadership federally and here in Washington State. Thanks, Deanna. Who's our next question from?
Okay. Yes, our next question comes from Shelley in Woodway, and her question is about the upcoming election and what Congress is doing to protect the election and protect voters. Shelley, you can go ahead and ask your question.
Hi, thank Shelley. You, and thank you, Congresswoman. Hello. Thank you for being there for us.
My pleasure.
I'm calling. My question is this: what kinds of protections are being considered by Congress and at the federal level to make sure that the upcoming election in November, first of all, takes place, and secondly, how to protect people who are going to participate in it, the voters? Are they thinking of proposing legislation that would allow everyone in the country to vote by mail, for example?
Thank you for that excellent question. Yes, there is broad recognition and desire in every Democrat in Congress and in the Senate that we need to have the ability to vote by mail and also the ability to vote in person for people who don't have the ability to do by mail, but to have that in every state in time for the November election. I cannot remember the dollar figure, but we asked for robust funding for vote by mail throughout the country and did not get anywhere close to what we requested. We have put down a marker, though. It is a priority, and with more public sentiment, the way you're talking about this, if we can keep this in the forefront of people's minds, that we cannot ask people to go to a polling place and put themselves in harm's way if we want to run our democracy and have every vote count and not put people in danger. So there will be a steady drumbeat for this, and that is why there will be a fourth package and a fifth package. Susan Del Bene is the main sponsor, I believe maybe with Earl Blumenauer, on a bill specifically to have mail-in ballots all across the country, and that has the support, the broad support of Democratic Party in Congress and the Senate. So we're working on it. Next question.
Thank you. Our next question comes from Bill Miller in Leavenworth, and he has a question about migrant workers, which of course is applicable in the 8th Congressional District, and how workers and farming communities are being supported in this crisis. Bill, you can go ahead and ask your question.
Bill?
First off, thank you very much for this town hall meeting. Thank you for being our member of Congress and the smart people on this list who are providing additional items. And I hope somebody is keeping track of that at the Democratic or the congressional level, because you've got lots of solutions. And so my question had to do with our local economy and the people that fall underneath the normal scan of employees, underemployed, marginal employees, the farm workers, a whole series of people that won't show up under the normal circumstances. And what are we doing for the next round of potential budget considerations?
Bill, thank you for that question. So there are multiple parts to that question. First, I would say that people who are non-traditional employees, self-employed, working in the gig economy, underemployed, they all have a place under this bill we just passed to get unemployment insurance. And for part-time workers who usually cannot, there is incentives in there where the federal government will match, we'll do like a 50-50 match with the state government if they will provide benefits for part-time workers as well. So that's for that group of people. Now, you bring up a really, really good question, an important question with our farmers, and especially their reliance on guest workers from Mexico, because this is a situation where our apple and cherry farmers, for example, need to rely on guest workers coming from Mexico to pick their crops. They have to make those contracts months in advance in order to have people here from Mexico by June. And here's the thing. Right now, we're in the middle of this epidemic, and we have no way to spot test people. And if we make that contract and they pay out that money, and then there are 50 people on a bus coming from Mexico up to Washington State over several days, one person with the infection on that bus could then have everybody sick by the time they get here and then have no workers. This is why I have been on the phone with farm workers and farmers about this very notion. And there is some thinking that they would like to have more reliance on domestic workers, especially with many people having lost jobs, say, in the hospitality industry. The problem is that unemployment benefits do not incentivize going out to work in the fields, which is backbreaking. And also those workers are not the experts in working in the fields. And so this is a place where I would imagine point-of-care testing for coronavirus would be critical, because then you could take every one of those H-2A visa holding workers before they get on a bus and swab everyone and make sure nobody has this virus. And you could swab every single day until they are safely here in Washington. You could even continue to test because they are in tighter, dorm-style housing to make sure that they stay safe and that we don't put their health at risk, and that we also don't put additional burden on an overstrained healthcare system here. So there are many ways of thinking through this, and I think point-of-care testing really could be critical to making sure we can continue a guest worker program. Who's next?
Thank you. Yes, so thank you everyone for joining. That's just about all the questions we have time for. We have time for one more question. And this question is from Drew in Sammamish and has to do about how we can help and support first responders. Drew, you can go ahead and ask your question.
Hi there. Thank you so much for what you're doing and all the other.
Oh, thanks, Drew.
All the other healthcare workers. My question is if I'm a longtime first responder and we have PPE equipment, can we donate it? Is it helpful? Is it useful? It's N95. And how do we donate also our services?
Drew, first of all, thank you for your years of service. That is incredibly thoughtful of you. I have my notebook in front of me, but I fear that I will not be able to find this email address quickly enough. But Washington State has set up a specific email account so that people who have supplies to donate can email and say what they have, and they have a central database of what people have and where it is and what the needs are. And what I will do is I will have Devin reach out to you because I don't think I'm good enough to flip through my book right now and find it for you. And I cannot get that to just pop right into my brain. But yes, there is a centralized location, an email address where you can email email information about goods that you have. I will refer you to the Washington State Department of Health website, where they probably have that listed right on the website. Drew, thank you so much for your service as a first responder, and thank you to all the first responders, healthcare workers out there, researchers out there, and public health officials who are working so hard to keep us safe during this very serious and anxiety-provoking time. And thank you all for supporting me and for joining me on this call today.
Thank you, Congresswoman. Thank you for speaking to all of us. If we did not have a chance to address your question, thank you for your patience. You can always reach out to the campaign, and we're happy to be a resource. And stay home and stay healthy, everyone.
Stay home and stay healthy. Bye now.